as you can see, anyone can do CPR. By the end of this course, you are going to understand and be able to perform CPR on an adult, a child, and an infant. First steps. Number one, after you identify that the scene is safe for you to enter, you are going to come in and identify that your victim is truly unresponsive, which means you are going to tap them on the shoulders and say, "Are you okay? Are you okay?" If it is an infant, the best place to tap them is the bottom of the feet because that's where they're the most responsive. If they do not respond to you, you are going to perform what's called a head tilt chin lift. Notice that she is using two hands and she's tilting the head all the way back, and then she's lifting the chin up to get the tongue out of the way. And then she is looking, listening, and feeling for breathing. Her ear and her cheek are next to the mouth so she can listen and feel for breathing, and her eyes are staring directly at the person's chest. So she is looking to see that that is going up and down for any sign of breath. And we are going to look, listen, and feel for breathing with two hands, mind you, on the victim's head for 5 to 10 seconds. If they are not breathing, we are going to assume that they do not have a heart rate or they will not for long, and you are going to immediately go into CPR.
Hey, are you okay?
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive.
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions. Keeping your arms straight, push down at least 2 inches, then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. For a child, push down about 2 inches, and for a smaller child, you may only need to perform chest compressions with one hand. Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a past-neutral position. For a child, you'll only need to tilt the head to a slightly past-neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath.
1 and 2 and 3 and 4.
Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch.
1 and 2 and 3 and 4 and 5 and 6.
You have performed 5 sets of CPR on a child. You are alone and need to call 911.
17, 18, 19, 20, 21, 22, 23, 24.
EMS personnel take over.
28, 29, 30.
You are alone and too tired to continue. Or the scene becomes unsafe.
1 and 2
Have
and
the
3
AED
and
and
4
first aid
and
kit.
5.
All right, so quick summary. Again, you check the scene, you make sure the scene is safe. You check for responsiveness. Are you okay? Are you okay? Then you perform a head tilt, chin lift, look, listen, and feel for breathing for 5 to 10 seconds. If they are not breathing, you go into compressions. An adult and a child, you're going to compress the chest approximately 2 inches deep, and you want to make sure that your shoulders are straight above your hands and that the heel of your hand is in the middle of the chest because this is where the heart is located. You need to compress straight up and down so that you are compressing the heart down to pump the blood out and then straight back up, allowing the heart to come back to full position to allow it to refill with blood before you compress it again. And you count out loud. 1 and 2 and 3 and 4 and 5. And if you're wondering, yes, it is to the beat of the Bee Gees song Staying Alive. So if you need to use that for timing, you go right ahead. So on this one, you can find your pillow. I'm going to play it and I would like you to practice along. While they do this, again, you're just going to have to mimic that your pillow has a head, or if you have a doll, you can head tilt, chin lift your doll or your monkey or whatever it is. I'll give you a second to get set up. Okay.
Okay, it's your turn to practice 5 cycles of chest compressions and rescue breaths. Begin by kneeling beside your mannequin with your gloves on and your breathing barrier nearby. Next, place your hands on the center of the mannequin's chest. Make sure your fingers are interlaced and off the mannequin's chest. Your shoulders are directly over your hands and your arms are straight. Count out loud and keep pace with the metronome while giving 30 compressions. Ready? Begin.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 25, 26, 27, 28, 29, 30.
Good. Now place the breathing barrier and open the airway. Pinch the nose, make a seal, and give 2 rescue breaths. Immediately give another 30 chest compressions. Remember, compress at a rate of 100 to 120 compressions per minute, and a depth of at least 2 inches for an adult. For a child, compress at a depth of about 2 inches. Great job! Now, open the airway and give 2 rescue breaths. Now back to chest compressions.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16,
Remember,
17, 18,
push hard
19,
and
20,
fast.
21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
You got this. Okay, 2 more rescue breaths. Keep going. Give another set of 30 compressions and 2 rescue breaths.
7 and 8 and 9 and 10 and 11 and 12, 13.
Remember, allow the chest to return to its normal position after each compression.
22, 23, 24, 25, 26, 27, 28, 29, 30.
Last set of compressions.
3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27,
You're almost
28,
there.
29, 30.
Finish with 2 rescue breaths. Good. You can now take a rest.
Nice job. So if you did this, you saw that 2 minutes sometimes takes a little bit longer than you thought it would, and maybe is a little bit harder than you might have thought it was. So you can see why it's important if you're giving CPR to have more than one person giving CPR, and that if you're too tired to continue, that you stop, take a break, and then resume CPR when you feel like you can. Because if you do it to the point of exhaustion and you pass out from exhaustion, you're not going to be any help to that person, and then the EMTs have to care for you along with the person who's already passed out. All right, next video is on infant CPR. So again, infant CPR is the same. It's about 30 compressions to, not about, but it is 30 compressions to 2 breaths. So they'll talk about the differences in infant CPR.
If an infant is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR. Ensure the infant is on her back on a firm, flat surface such as the ground.
The baby's unresponsive.
Next, stand or kneel to the side of the infant and place 2 fingers on the breastbone just below the nipple line with your hand closest to the infant's feet. Now, give 30 chest compressions. Using the tips of your fingers, push down about 1.5 inches, and then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. After the 30th compression, prepare to give 2 rescue breaths. First, place a breathing barrier over the infant's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a neutral position. Make a complete seal over the infant's nose and mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath. Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch. You have performed 5 sets of CPR, you are alone and need to call 911. EMS personnel take over. You are alone and too tired to continue, or the scene becomes unsafe.
Have the AED in the first aid kit.
So you see some of the only differences in infant CPR is obviously you don't have to push as hard. You only need to compress down about 1.5 inches, and that sometimes you only need to use 2 fingers instead of a whole hand. So this other hand over here can be used to maintain that open airway. So again, the differences: child compressions can be one hand in the middle of the chest. The other hand can be used to maintain the open airway. And an infant is 2 fingers in the middle of the chest. But both are 30 compressions to 2 breaths. Okay, what if I am giving a rescue breath? Remember, your rescue breaths last about 1 second. What if I am giving a rescue breath and the chest does not rise and it does not go in? So if you are going to give a rescue breath and you notice that the chest does not rise, you are going to first assume user error. So you're going to re-tilt the head back a little bit further than it was, and you're going to give a rescue breath again. If that second rescue breath does not go in, then you assume that they have an obstructed airway and you go right back into your 30 compressions. The only difference is that after those 30 compressions, you're going to open the mouth, you're going to check the airway, see if you see anything. If you do, take it out. If you don't, pinch the nose, head tilt, chin lift, and go right back into your 2 breaths. If the first breath does not go in, re-tilt, try again. That is the only difference between obstructed airway and CPR, is that between compressions and breaths, you check the mouth. Here again is just a table about just the differences between the two. I think the Red Cross likes to ask questions about compression depth. So adult and children are 2 inches. Infants are 1.5. They also like to ask about head position, in that adults are past neutral, children are slightly past neutral, and infants are just to a neutral position or straight up and down.